News Now speaks with doctors all across the DMV about health issues that may impact many of us. According to the CDC, 1 in 8 new mothers suffers from postpartum depression. Well, today I spoke with Dr. Jennifer Keller, an OB-GYN at the George Washington University Hospital, about the FDA approving zuranolone. It is a first ever pill for postpartum depression. It is this week's installment of What's Going Around. How much of a game changer is this new postpartum pill?
Well, I would say that this pill makes me excited for a couple of reasons. One is that it's always great to have lots of options to give patients to help them decide what the best treatment is for them. The second is that this pill shows that there is an increasing focus on mental health and pregnancy and the importance of this in society and helping people get the care that they need, which it's not traditionally been something that people have talked about or thought about. So the fact that we have now FDA approved pills for treating specifically postpartum depression is really exciting.
Dr. Keller, are there any side effects, and is this drug the best option for all new moms?
Great question. So this medication does have some side effects. It is a daily pill to be taken for 14 days, and the most common side effects that were reported are sleepiness and dizziness. So there's actually warnings that say don't drive for 12 hours after taking this medication. The medicine does come with a warning as well that it may increase the risk of suicide. That actually wasn't seen in the studies of this medication. It's a warning that comes with any medication used to treat depression. So the most common side effect is dizziness and sleepiness. This medicine is not necessarily the right choice for every person. There are studies require that people did not breastfeed while they were taking this medicine. And so for people who are breastfeeding, you'll have to counsel them about that there's lots of unknowns with this medicine and its impact on breastfeeding. So people may choose not to use this medicine because of that. We also have other good options for treating postpartum depression that may take a little bit longer, like traditional medicines for treating depression and anxiety. Zoloft and Prozac are examples of things we really commonly use to treat postpartum depression. And then finally, there are people who prefer not to use medications and prefer to start with talk therapy and improving their sleep and social support and things like that, which are for generally people with less severe symptoms.
Well, Dr. Keller, we appreciate you taking some time and lending your expertise and insight into this topic. Thank you very much.
You're very welcome. Thank you so much for highlighting this really important topic.